So we're asked in our first question to recognize cues by dragging the top 5 client findings that would require follow-up to the box on the right. So here, we're wanting to follow up on those things that are abnormal, unexpected findings that take priority. These are the top 5 findings, things you can't wait to address. So let's just take these one at a time. So his pulse of 104, that is elevated. I'm not sure yet if that's expected or unexpected. He's got 7 out of 10 pain, so this could be due to his pain. I'm going to hold off on calling that a top 5 finding. I would expect this to improve once his pain is controlled. The abdominal pain, 7 out of 10. So abdominal pain is kind of a challenging symptom to approach because it could be anything. It could be something in his GI tract, sure, and this certainly looks like it might be because he also has blood in his stool. But it could also be a symptom of a myocardial infarction or an aortic dissection or something really life-threatening, especially when it is this severe and accompanied by nausea and vomiting. So definitely problematic and something we want to follow up on. I don't want to just let him stay here in pain. If nothing else, I want to treat that pain with an analgesic, right? So yes, I'm pretty sure this is going to be something that I follow up on. Similarly, nausea and vomiting. He's been vomiting for 3 hours. And you'll remember that the very elderly and the very young are especially sensitive to becoming dehydrated with fluid losses. So I'm going to follow up on that. Hypoactive bowel sounds. So remember, when we're listening to bowel sounds, that's telling us about the gastrointestinal motility. If those are hypoactive, this could potentially mean that he has some ileus, some decreased motility, some decreased perfusion to the intestines. That would certainly manifest as this pain, nausea, and vomiting. So I'm concerned about that. That could mean he's not getting enough blood flow to his intestines, and that would make this then an issue of circulation, right? So that is going to be in my top 5. Presence of blood in the stool. It says here, these are small streaks. I don't have any lab results at this point yet in the case, so I don't know if this is a gastrointestinal bleed and he's quickly hemorrhaging and would require a blood transfusion, or if it's something benign. But because it has the potential to be a gastrointestinal bleed, it's something that I want to be concerned about as a potential circulation issue. Okay, now we've been kind of holding off on addressing his vital signs because we're not sure how much of this is just related to his pain, because naturally, if someone is experiencing severe pain like this, they're going to have an elevated heart rate and an elevated blood pressure. And I've got 4 of my 5 findings, so I'm really just looking for which one of these 3 is going to be the most concerning to me. And of them, I think if I was worried about this vomiting having made him dehydrated, I would see a high heart rate like that, but I would also see a lower blood pressure and then some other signs of poor perfusion like a slow cap refill or thready peripheral pulses or mottling in his extremities. None of those symptoms are described here, so I'm not too concerned about these vital signs, the high blood pressure and the high pulse, because that's most likely a manifestation of his pain. But then when I look at the temperature, 100.1, now this is becoming really concerning for some infectious or inflammatory process. So I'm going to include that one in my top 5. And I'm satisfied that these are the 5 I'm going to follow up on. There's something I want to do about each of these findings. I need to figure out if this hypoactive bowel sounds is hypoperfusion to his intestines. I need to make sure he's not having a GI bleed. And if nothing else, I need to give him an analgesic for his pain and an antiemetic for his nausea and vomiting. And we'll see that, yes, we got each